Welcome to NSG 222, Study Session 5, Infection Process. Introduction. Infectious disorders remain a major public health concern and a major cause of death in developing countries. However, deaths from infectious disorders have declined in developed countries, but multiple drug-resistant strains of bacteria have also emerged. Learning outcomes. At the end of this study session, you should be able to 1. Define infection process and related terms in infection process. 2. Highlight the types of infection and the stage of infection. 3. Describe the cycle of infection. 4. Explain the nursing interventions to disrupt the cycle of infection. 5. List common emerging and re-emerging infections. 1. Infection. Infection is invasion of the body by a disease causing microorganism pathogen with resultant host response. It may be localized or systemic. It was mentioned in the previous study session that infection is not the same as inflammation, even though there may be similarities in the signs and symptoms. Infection is invasion of the body by a disease causing microorganism pathogen with resultant host response. It may be localized or systemic. The infectious agents may be bacteria, fungi, protozoa, viruses, helminths, etc. It should be noted that infection can only be said to occur when the host-specific body defense is overwhelmed by the invading organism. Types of infections. There are 3 types of infections. These are given in Figure 5.1. Communicable diseases, nosocomial infections, opportunistic infections. Communicable diseases. Communicable diseases are infections which can be transmitted from one infected person to another person, animal or object to an uninfected person. Nosocomial infections. These infection types are acquired within the healthcare facility, that is, hospitals, clinics, and other places where healthcare is given. Opportunistic infections. These are infections which occur in immunocompromised hosts, e.g., elderly person, organ transplant recipients, caused by microbes that rarely cause infections in the persons with healthy immune systems or caused by organisms that normally inhibit hemostasis or the normal flora of the body. Angrove, Utel, 2005. Stages of infections. All infections progress through 4 stages as given below. Incubation stage, prodromal stage, illness stage, stage of convalescence. Take 2. Stage of convalescing. 1. Incubation stage. Incubation period describes the time between entry of an infectious agent and the manifestation of signs and symptoms. In most infections, the host is most infectious to other people during the incubation period because the infectious agent invades the tissues and multiplies to produce the symptoms. The duration of incubation period differ from one type of infection to another. For example, the varicella, chickenpox. This period is between 2 to 3 weeks and the infected person is contagious from 5 days before the skin eruption occurs. 2. Prodromal stage. This explains the time from onset of non-specific symptoms to the time when specific symptoms appear. During this period, there is also a risk of infection transfer to other people. For example, a client with chickenpox. The prodromal stage occurs with elevation of body temperature and within 24 hours, the skin eruptions appear. 3. Illness stage. The client experiences manifestations of more specific symptoms of the infection. This may last for days. 4. Convalescing stage. This is heralded by disappearance of symptoms until the client resumes the previous healthy state. The infection process or cycle of infection. For an infection to occur in a person, the following links must be present in a sequential order: infectious agent, reservoir of infection, mode of transmission, portal of entry, susceptible host, portal of exit, infection. 1. Infectious agent. This is an infection causing microorganisms, bacteria, virus, fungi, etc. 2. Reservoir of infection. Reservoir of infection may be a person, plant, animal, or other substances, or location which provides nourishment for microorganisms and enables its further dispersal. In humans, common reservoirs of infection include the urinary tract, respiratory tract, surgical wounds, etc. Airborne transmission. Airborne transmission is usually from droplet nuclei or dust that are suspended in the air. The longer the particles are suspended in the air, the greater the chance it will find a portal of entry to a human host. White, Duncan and Bromley, 2013. Examples of airborne transmission infection include tuberculosis and histoplasmosis. Vector-borne transmission. This is transmission by animates such as mosquitoes, fleas, lice, and other animals. Portal of entry include the following: the skin, gastrointestinal tract, respiratory tract, genitourinary system, transplacental. The portal of entry is the route through which the infectious agent gains entrance into the susceptible host, the skin. The agent may burrow. Take 2. The skin. The agent may burrow into the skin, larvae of hookworm, or enter the skin through a break in the integument as occurs in surgical wounds, pressure ulcers, etc. Gastrointestinal tract. This is usually from contaminated foods and drinks. Example: typhoid infection, hepatitis A. Respiratory tract. Through inhalation of droplets, e.g., tuberculosis, influenza, measles, etc. Genitourinary system. Contamination from the GL tract. Transplacental. From mother to the unborn child. Example: syphilis, HIV, hepatitis B. Six. Portal of exit. This describes the route through which the agent leaves the host. When the portal of exit is identified for specific organisms, it guides interventions to prevent transmission and spread. For example, wearing gloves and gowns when changing lining of a patient infected with hepatitis A. 7. Infection. The successful entry of the organism into a susceptible host begins the process of infection. It should be noted that not all invasions cause a pathologic process or disease. The infection cycle. Opportunistic pathogens are less virulent and only cause disease when the host defenses are impaired. Exposure to infectious agents can result in exposure with no infection, subclinical infection, disease limited by host responses, resolves without treatment, severe diseases requiring treatment. Infectious agents. These are biological agents which cause infection in humans. They could be any of the following: viruses, smallest obligate intracellular pathogen, bacteria, fungi, parasites. Examples: helminths, cestodes, tapeworm, nematodes, roundworms, trematodes, flukeworms, protozoa, malaria, amoebic dysentery. Arthropods, vectors of humans and animal diseases, e.g., ticks, mosquitoes, biting flies, and ectoparasites. Human ectoparasites, e.g., mites, scabies, lice, head, body, pubis, fleas. The possibility that the organism will cause an infection is determined by three major factors. These are the organisms: virulence, ability to grow and multiply; invasiveness, ability to enter tissue; pathogenicity, ability to cause disease. Source of infectious agents. The sources of infectious agents may be endogenous, from the host's own microbial flora, e.g., opportunistic infection, or exogenous, external sources, e.g., water, soil, food, air; congenital, mother to child, vertical transmission; inanimate object, fomites, contaminated fomites, e.g., handkerchiefs; animal sources, e.g., cat scratch disease, rabies, Lyme disease, tick-borne disease. Three. Interventions between portal of exit and mode of transmission. Hand hygiene, proper disposal of contaminated objects, medical and surgical asepsis, gloving, masking using goggles. 4. Interventions between mode of transmission and portal of entry to the host. Proper disposal of sharps, sterile techniques, gloving, gowning, maintaining skin integrity. 5. Interventions between mode of transmission and portal of entry to the host. Proper disposal of sharps, sterile techniques, gloving, gowning, maintaining skin integrity. 6. Interventions between the susceptible host and agent. Eliminate infection before it begins through good nutrition, immunization, exercise, intact immune system, adequate sleep and rest. Antibiotic-resistant organisms. The word resistance is used when pathogenic organisms change in ways that decrease the effectiveness of a drug or a group of drugs. This is because bacteria are highly adaptable organisms, evolving genetic mutation and acquisition of new DNA, and biochemical produce enzymes that deactivate the drugs, means of resisting antimicrobial actions. Take 2. Means of resisting antimicrobial actions. These processes or changes alter drug target sites so antibiotic cannot bind to or enter the bacteria. Lewis and Elskemper, 2011. Factors that enhance drug-resistant organisms. The following factors do enhance drug-resistant organisms. 1. Administration of antibiotics for viral infections. 2. When providers succumb to pressures by patients to prescribe unnecessary antibiotic therapy. 3. Using inadequate or incomplete drug regimen for treatment of infection. 4. Using broad-spectrum or combination agents for infections that should be treated with first-line medications. 5. Incomplete doses by patients. 6. Limited resources. Infection. Patients' teaching guide to reduce antibiotic-resistant infection. The following, if followed, would reduce antibiotic resistance infection. Do not take antibiotics to prevent illness. Frequent hand washing. This is the single most important practice to prevent infection. Follow directions. Skipping doses facilitates resistance. Complete antibiotic regimen. Should not stop treatment when symptoms improve or disappears. Do not request antibiotics for flu or colds. These are viral infections. Do not take leftover antibiotics from other patients. Old antibiotics may lose their effectiveness and may be fatal. Gerontologic implications for infection. 1. Age-related changes such as decreased immune competency, presence of comorbidities, increased disability contribute to higher rates of infection among the elderly. 2. Common infections. Take 3. 2. Common infections include pneumonia, UTI, commonly nosocomial with catheters, skin infections, and TB. 3. Older adults may present with cognitive and behavioral changes as signs of infection. 4. Fever may not be present as a sign of infection, even when infection process is present. This is because adults have lower core temperature and decreased immune responses. Emerging and reemerging infections. Emerging infections are those with increased incidence in the last 20 years, and the incidence strengthens to increase in the immediate future. The actual sources may be unknown but may be associated with contact with animals, e.g., severe acute respiratory syndrome (SARS) linked to civet cat, West Nile virus from mosquito. Other sources of emerging infections are changes in known diseases, biologic warfare, or bioterrorism. Over 30 new recognized infections have emerged in the last 20 years. Examples: HIV, Lyme disease, hepatitis C, SARS, Ebola virus. Others thought to have been under control: tuberculosis and drug-resistant strains of bacteria. Organisms may alter its normal path of transmission. Example: influenza, a viruses were typically spread from birds to pigs to humans. Recently, avian flu spread from chickens to humans, first seen in Hong Kong in 1997, Netherlands in 2003. Ebola virus, a public health challenge because the reservoir and path of transmission is unknown. Re-emerging infections. Tuberculosis decreased steadily from the mid-1950s. From 1984 trend changed. TB incidence began to rise. Causes: increased HIV-infected persons, major cutbacks in public funds for health, development of multiple resistant strains (MDR-TB). Measles, due to travels to endemic countries. Summary: in this study session, you have learned that 1. Infection is invasion of the body by a disease causing microorganism pathogen with resultant host response. 2. Communicable diseases, nosocomial infections, and opportunistic infections are the three types of infections. 3. All infections progress through 4 stages: incubation stage, prodromal stage, illness stage, and stage of convalescence. 4. For an infection to occur in a person, the following links must be present in a sequential order: infectious agent, reservoir of infection, mode of transmission, portal of entry, susceptible host, portal of exit, and infection. 5. Infectious agents are biological agents which cause infection in humans. 6. Emerging infections are those with increased incidence in the last 20 years, and the incidence threatens to increase in the immediate future. End of study section 5. Thanks for listening.